ChartGuard OnDemand was created in response to clients that loved our ChartGuard business continuity and downtime product who also wanted to use that same integrated, easy-to-read ChartGuard PDF format for medical record requests for various insurance and legal audits. In this case, the clients wanted that same PDF file, but needed to be able to generate it for a specific population. In working with them, we created a new version of ChartGuard called ChartGuard OnDemand. For this, we've taken the ChartGuard engine and built a user interface on top of it to select and queue up the patients whose charts you need. In continuing to work with clients, we found that many practices spend hours per week or more finding information in the patient charts, saving it out, then trying to collate those bits of information into a single file, whether physical or electronic. This process would be repeated tens or hundreds or thousands of times based on the number of patients under review. Our main design parameter was to automate this process, so you simply give the search criteria and ChartGuard will pull in the sections of the chart you need, along with the relevant EHR documents and document manager files. Additionally, we wanted to deliver that same easy-to-read, inclusive PDF file. The end goal is to recover the hours spent each week pulling charts out of EHR so your staff can focus on more pressing matters. Turning now to the user interface that we have up on the screen, I'm going to do a quick chart request for a population of patients whose last name starts with Test. While I'm doing this, you can see how quick the interface is and how easy it is to queue these up and do a request for these charts. Now that that's underway, I'm going to take you through the user interface and how it works. We normally see several scenarios in which this is used. One where you're looking for an exact patient, maybe for a referring provider or for the patient itself. Or you might be looking for charts by provider or financial class to cover some kind of audit. So we have the ability to search for specific patients by name, by various ID numbers. If you're looking by provider, you can pick them from the drop-down list. If you're looking by financial class, you can pick that from the drop-down list too. You can use a combination of these parameters to further limit the number of charts you're going to pull. Additionally, we understand that usually these audits cover a window of time, so we give you several ways to specify that window. On the right-hand side at the top here, we see the contents of the PDF file, the various modules and documents that you'd want to pull in for an audit. So in the upper right, we see a lot of items that are checked already. However, in some cases, you may not need histories. Maybe they don't concern about the histories, they are just concerned about the treatments. And then the documents, you go ahead and pick those by document type or document group. So we give you various options for what you want to pull so that you only pull what's needed. This interface is constantly growing, so we're always looking for new input on ways to use it. Let's go check our request that was done already. So I'm going to pick all these that we sent before, and I'm going to get the history on them and see where they are in the process. As we click refresh, we'll see that a number of these have been completed. Let's go ahead and jump in and show you what the ChartGuard PDF format looks like with these sample patients. So I'm going to right mouse and go down to View and pull this up. The files themselves, again, are simple PDF files that can be read on just about any computer platform. So there's no problem if you need to hand these off to another party on what machines and what software they have. Pretty much everyone can read PDFs. The chart is very inclusive, so there's the modules in here, documents, and if they are using it electronically, we go ahead and bookmark the PDF file so they can go to the sections that they're looking for. The section shown on the left here is not the limited amount of sections, it's just the ones that are available where there's data for this patient. If there were additional sections populated and selected, they'd show up here on the left. So the chart's going to vary depending on what history you have in your database. Additionally, we understand you may want to hand these out in bulk. So we can make available to you the output folder where the PDFs exist so that you can grab them and either upload them or move them onto an encrypted drive or USB stick. Again, ChartGuard OnDemand was written to be easy to use, flexible, and solve your problem of generating patient charts. We hope you've enjoyed this little tour, and we appreciate your time.